Welcome everybody. This is the infection prevention. We used to call it infection control, but we don't want to control infections, we want to prevent them, okay? My name is Patty Esmail. I've been here at CHI St. Vincent since May 23rd of 1988, so a little while. I was a staff nurse in the CVICU. My background's in critical care, but in 2008 I moved down to the clinical education department, and that's where I've been ever since. So, infection prevention, it's important, especially in this day and time, yes? With the COVID-19 and all of our superbugs that we've got. So what we want to make certain that we do is that we understand why infection prevention is important, how can infections be prevented, what is the antibiotic stewardship program, and the common spirit goals for 2020. And just remember, if we stay in control of what we're doing, we want to reduce harm to our patients. That's why we do infection prevention of any kind. We want to make sure that our outcomes are improved. And we know that infections can lead to death. We don't want to do that for our patients. So they increase length of stay, they increase cost to the patient, they increase cost to the facility. How can we prevent infections? Or you? All of us. The first step is what?
Hand hygiene.
Hand hygiene. That's exactly right. And with today's news, you'd think that we never thought about washing our hands before. I've been a nurse so long. I remember when we did nursing without gloves. So we've come a long way. But standard precautions basically are that we will do hand hygiene and that we will wear gloves whenever we're going to come in contact with any patient's blood or body fluids, okay? And so, we want to make certain that we understand what personal protective equipment or PPE we need, given whatever type of infection we have. So what I've got is I've got a little exercise. And I'm going to give you a little bag. I've given you a bag, and it has all of the things that you might have to access. So I might need a head cover. I might need a standard face mask. I might need a gown, and we have the lovely blue plastic gowns. I might need a type of N95 respirator mask. Depends on the bug that my patient has. A pair of gloves, non-sterile gloves. And then I might need a face shield. It just depends. Face shield, goggles, any type of apparatus. So what I'm going to do is, I'm going to give you a scenario, and I want you to tell me what type of PPE we need to have. I want you to pull out that PPE out of your bag. So you have a patient that's been diagnosed with MRSA. That's methicillin-resistant Staphylococcus aureus. And they have an open wound. Now, this precaution we use even if we suspect somebody has a history of that. If they had a history of it when they discharge from the hospital, they will be flagged as having it when they come back in. So what type of precautions will we use?
Contact precaution.
Very good. Contact precautions. So what does contact precautions say that I need to have?
A gown and gloves.
A gown and gloves. And so I'll put the gown on first. And the gowns that we have, they're these blue plastic. The neck goes over, your arms go through, and you tie it in the back. It's plastic so that when you need to remove it, you can pull it and snap that halter top that you've got. Pull it here and snap the belt, and then you can remove it while keeping it all contained. Very good. Now, what if I had a patient who was diagnosed with hepatitis B? They don't have any open or draining wounds.
Standard precaution.
That's exactly right. Just because they have hepatitis B doesn't mean I have to do anything more than just have good hand washing and gloves, right? So that's very good. Now what if my patient had tuberculosis?
We need airborne precautions.
They need airborne precautions. That's exactly right. So when I do airborne precautions, what PPE do I need?
The N95 mask.
What do I need to remember about N95? Can I just pull an N95 mask? No, that's right. You have to be fit tested, so you'll make certain, you'll find out from your department if it's required for you to be fit tested. Right now, with the COVID virus, everybody that's working in a clinical area is being fit tested to wear an N95 because we don't necessarily know when someone's coming in with it. If they had, because when you think about what also could need airborne, chicken pox. So what if they had open weeping lesions? What would I add to my N95?
Also a gown.
A gown and gloves, that's exactly right. So we can combine our contact precaution with any of the other types of precautions. Now, it's between the months of November and March, and you've admitted a patient to your unit that has influenza. What type of precautions am I going to use for that one?
Droplet precaution.
Droplet precautions. So droplet precautions, influenza, but what type of mask am I going to choose?
The face mask.
Just the plain face mask. That's exactly right. I don't have to have this one. Droplet infection means that when they cough it up, it's in a droplet form. It doesn't ride on the airwaves. And so as long as I'm over 6 feet away, I don't even have to have any protective personal equipment, right? But if I'm within 3 feet or greater, I have to have a mask on. And if I have to transport the patient, what do I do?
Put a mask on the patient.
What if I have to transport someone who's in airborne precautions? So we mask that patient too. That patient does not, even though we as the providers wear an N95, the patient just needs to wear a standard surgical mask if we have to transport. Now, let's talk about our most current bug that's out there right now, COVID-19. Here's what you have to remember. It is a droplet infection, but they have found out that those droplets travel on the airwaves. So they are asking that if you have someone suspected or confirmed, that you not only have your gloves, your gown, you're going to have an N95 because it travels on the airwaves, okay? And because it transmits through like the mucosa, I'm also going to have the face shield, or I'm going to have goggles on because they could cough and it could get in my eyes and it could be transmitted to me in that manner. So we just want to make certain that we remember that. Also PPE, remember, if we have enough in stock, we don't ever reuse PPE. But you have to remember, you have to protect yourself and you have to protect the patient. So those are the most important things. Any questions about what type of PPE we have?
Do we have N95s here in the hospital?
We do have N95s in the hospital. They are in short supply, but it's true across the world that they're in short supply. And so I believe current practice right now is that you're issued an N95 mask at the beginning of your day. And I think you wear your N95 and you put a surgical mask over it so as not to dirty it, and reuse it if you have to. All right, so the antibiotic stewardship program, we spoke a little bit about it, we speak a little bit about it in the medication segment, but we just want to make certain that we reiterate to you or reinforce to you how important it is that we practice good antimicrobial stewardship. We don't want to give anybody an antibiotic if they don't need it. So the goal is to only give those who need antibiotics, antibiotics. So for example, someone comes in with pneumonia from COVID-19. COVID-19 is a virus. Is there an antibiotic that's going to help me with a viral pneumonia? And the answer is no. So there's no need to throw antibiotics at it because it's not going to make any difference. The only thing it's going to do is allow that normal bacterial flora that's there to learn to live in an antibiotic environment. We want to make certain that they get the right antibiotic, that they have the right dose at the right time and for the right duration. Common spirit goals. We are looking at sepsis. We want to make sure we use the sepsis bundle. Sepsis is now the leading cause of hospital deaths, and it's considered a never event. So what do we mean by never? Never means it shouldn't happen while you're here in the hospital. And if it did happen to you, then did we have a breakdown in the process? So we want to make certain that from the very beginning when we are introduced to a patient, that if it is something that might be sepsis, that we are thinking along those lines. So we have a SIRS checklist. Many of you may be familiar with the SIRS checklist. The thing about the SIRS checklist is, though, you know, if your heart rate's 90, you pop positive. If your respiratory rate's 22, you pop positive. And when was the last time you called a doctor for those vital sign parameters? You don't. But we need to be mindful of that because that's the early beginning signs. And if we think they've got an associated infection, we need to get on it ahead of, before they have a systemic infection. We want to make certain that we do our daily rounding, that we're aware of our patient, our environment, and the C. diff protocol, they have changed how we handle C. diff. Not how we handle it as far as PPE. You're still going to use contact precautions, and you're going to be very mindful of that, that you've got enteric precautions along with the contact precautions. But they are not just willy-nilly culturing people that have diarrhea. We all have C. diff in our flora in our gut, okay? It's only when we give antibiotics and we kill off the normal bacterial flora that keeps C. diff at bay that we then have problems with it. So we've changed the way that we've done C. diff testing, and we've got a protocol for it. So look on your units. There is a ring that has a lot of laminated sheets on it that outlines our protocol for sepsis, for our Foley bundle, for our Clabsy bundle, for use of non-invasive means for taking care of incontinence. So look at that and use it as a resource and a guide for you when you're on the unit. Again, the coronavirus. So currently, at this time, we don't have visitors in the hospital. There's a very limited access. And because we don't do births here at the infirmary, we don't have to worry about trying to get a partner in here during that delivery. But here's what you have to know. Only hospital employees are allowed in the building right now. And we will continue those precautions until such time that it's warranted that we don't need to have those precautions in place. So make sure you've got your ID badge on you. You're screened at the entrance, and they'll take your temperature, ask you how you're feeling, and then they're going to give you a colored sticker. The color changes every day. So just remember that. Hand washing, hand hygiene. Remember to use your antimicrobial sanitizer. After every third use, wash your hands, because that stuff will literally eat your hands up. If I have C. diff, can I use hand sanitizer?
No.
No, because the hand sanitizer doesn't get into those spores. But here's what we know. We know that alcohol, bleach, those sorts of things kill the COVID virus. We still don't know exactly how long it lives on inanimate objects because it's so novel, so new. But just know, we take it very seriously, and we ask you to abide by the restrictions that we've placed. So if someone's traveled outside the United States or is coming in close contact with someone, and that person has a fever, I think technically it's 100.4, a cough, shortness of breath, put a mask on the patient, shut the door, call the house supervisor. If they've been screened and someone thinks that they are COVID positive, then we also alert infection control. Any questions? Well, Well, if you don't have any questions, then I thank you for your attention.